Okay, so let me just... Okay, so we would like to welcome this morning Margarita Bennett, who is going to be talking to us about fascia release, about self-care advice for therapists and helping them to release stress. We've already had a little bit of a mini chat, so I'm just going to hand it over now to Margarita to perhaps just introduce herself, and off you go then with your talk. So it's going to be an interactive talk today. So for anyone that's watching the replay, it is a case of, this is going to be a little bit extended because we're just going to do it as more of an interactive talk, and if people have got questions, they can ask those throughout. So over to you, Margarita.
Thank you. Right, let me recap. I'm Margarita Bennett. I am a clinical massage therapist, and what does that mean? It's quite a kind of medical term, but that's not just what I do. My speciality is fascia, which is connective tissue. And before we press the record, I was trying to explain to you guys what fascia is. So I'm going to start from the beginning for the people that are watching this on replay. Fascia is a viscous tissue, and it goes from the top of your head all the way to your toes, and it goes through you. So if you look at a piece of steak, the marbling that you see in that piece of steak is fascia. But on that's a dead piece of meat, so it becomes solid. On a live being, it's viscous, it's sticky, and it is all over. It goes through your muscles. So when you look at a beautiful anatomy book, everything is separate and everything's beautifully drawn. But that's not reality. Reality is that everything's meshed together, and everything that is meshed together is not just the muscles, it's also the cardiovascular system, the central nervous system, the lymphatic system. It all kind of sits together into this gloop. And when I describe it to a client, I say, envision yourself as a jelly baby with sticks in, because that's basically what we are. And the fascia is what holds our emotions, it's what holds basically our chemicals in our body. And I know that today we've been briefly talking about stress during lockdown, so I want to bring it back into that conversation, because stress or any type of emotion that you feel releases a chemical reaction. Anything that you eat, anything that you do, anything that you think releases a chemical reaction. And those chemicals are then lodged within the fascia. And those chemicals are also released within the central nervous system. So they kind of work together. So let's say if you're very, very stressed and you suffer from anxiety, the likelihood is that you're really, really going to be tight here because you're not going to be able to breathe properly. So you have the cortisol, which is the adrenaline that is flowing through you really, really fast. And because you hold it all here, because you're not breathing properly, then you might have a fascial adhesion here. So if sadly, silly of me to have worn black, but I hope you can see it. So imagine that I have a fascial adhesion here. Can't see. Can you see? It's kind of pulling my t-shirt. It's pulling it from here. It's pulling it from here. It's pulling it up. So that adhesion can cause pain. That adhesion can cause disease and uncomfortableness. So therefore you'll see those people that are kind of round shouldered and everything is really tight and everything's really stuck and they're not breathing. And then potentially that adhesion that's pulling here starts pulling everything up. And as it starts pulling everything up, you might start getting pain in your pelvis at the front, for example. Or you might have pain internally in your hip flexors because it's pulling in your psoas muscle, which is the big muscle that basically attaches to your hip flexors. So what I want to come back to, because I've lost my flow slightly, what I want to come back to is stress. So when you are stressed, you're releasing cortisol, you're releasing adrenaline. When you release cortisol and adrenaline, that then sits within the fascia and it sits within your lymphatic system. When it sits in your lymphatic system, starts blocking your lymphatic system. That's why you get some people that don't sweat. You get some people that have cancers, so breast cancer, that kind of stuff. That's because the lymphatic system starts building and building and building, and it's not clearing. So if you live a life of hypervigilance, where your central nervous system is constantly freaking out, your cortisol levels are going to be very, very high. So I know that we were talking, Siti, we were saying that you've been very, very stressed. So what I would recommend is that you need to focus on your breath. And I know that we've read, we've looked at, you hear it online all the time, breath work, different projects, different methods of doing it. But the breath is vital. And the reason why it's vital, and it has never really truly been explained, fascia moves with breath. Lymphatic system moves with breath. And the central nervous system is calmed with breath. So if you look at it as a full organic system that works together, breath is the key. You can do yoga, you can massage, you can meditate, you can do, sort of tapping, you can do all those kind of things. But if you are not breathing deeply and consciously, then a lot of the efforts that you're putting in are not going to be as optimum or as effective. Now, anatomically, this is your diaphragm, this is your pelvic floor. And then in the middle, you have two lines that go like this, which is the psoas. So I'll just quickly grab my book. It was on the page, but I've lost the page now. And the reason I want to show you this is because the psoas muscle is one of the muscles that I work with the most. I work with it on various different levels. I work with it fascially. I also work with it energetically. The psoas muscle is known as the muscle of the soul. And I'll explain to you in a second, in a medical fashion, why it's known as the muscle of the soul, and then in a holistic fashion, why it's known as the muscle of the soul. So I don't know if you can see that very clearly. That's the little chap here. Okay. In this book, it's very simplistic designed. It's much more complex than that. Now, this is the front view of a human body. So this is the lumbar spine, which is basically, if I were to take a photograph through me, that's the lumbar spine. And then your diaphragm sits up here and your pelvic floor sits down here. And then the psoas muscle attaches to the leg. And this muscle is the one that basically is massively connected to your solar plexus, to your diaphragm, because even though in that picture it doesn't connect it to the diaphragm, it is fully connected to the diaphragm. And it has a huge, it's like the second brain of the central nervous system. So the vagus nerve, which is a nerve that attaches from the back of your spine, goes through you, and it's the one that does all the autonomic stuff. So it does the breathing, the temperature, the heart rate, the hormones, the adrenaline, the cortisol, as well as many other taste buds, as well as many other things. That's the one that actually has been impacted by a lot of long COVID patients. Basically, the vagus nerve has been going mental, and that's why they're having all these different symptoms. Now, if you think the diaphragm's there, the pelvic floor's there, there is your psoas. When you breathe, this is what happens. And what's happening when you're breathing properly, and I mean deeply, not just to survive, by you massaging the body with your breath, you are moving the psoas, And by you moving the psoas, you are moving the kidneys, because the psoas massages the kidneys. The psoas also goes through, kind of around, kind of like this, the colon and the digestive system. So if, for example, you have a client that has IBS and they've checked out all the dietary requirements, the reason why they have IBS is because there is an emotional issue going on, a massive emotional issue, and the psoas is super stuck, and then they're either constipated or have diarrhea. And it's like literally like clockwork. As soon as you start working energetically on that space, it's their bowel movement starts and you can hear their stomach gurgling. It's quite amazing. So going back to the psoas and going back to the breath. If you're breathing deeply, your central nervous system gets tricked. It starts thinking that everything's calm, which it is. I mean, you don't have a woolly mammoth coming to eat you. But on many occasions, when we are hypervigilant, that vagus nerve is kind of on fire and is constantly thinking, there is a woolly mammoth coming to eat me. So therefore, I need to be ready to activate the psoas to run like hell. Because that psoas is the muscle that basically allows you to run like hell. So if we breathe, we calm the sympathetic nervous system down, because we're also moving that diaphragm and telling the body, I'm calm, I can breathe through it, and everything is okay. By you calming that, then that allows the lymph nodes to move, because by breathing, the fascia starts moving naturally. So I'm going to do a couple of breaths with you today to begin with, and then we'll continue. So I want you to put your hands on your sternum and on your tummy, like that. And I want you, without thinking, just take a really deep breath. Okay. Now, do 2 of those and connect with where you're feeling that. I'm not going to cue you as to where you need to do it yet. I just need you to just think, are you breathing into your tummy? Are you breathing into the front of your chest? Are you breathing into your shoulders? Connect with where you are breathing. Okay, so when I breathe like that, I tend to be filling the front part of my lungs. And I feel that I can't catch my breath fully. It's kind of like, yeah. So that in itself, that breath in itself is going to cause you anxiety, especially if you give that breath to a client, because they're going to go, but I can't breathe fully. So now I want you to focus the breath slightly differently. And I want you to focus the breath in between your shoulder blades. So as you breathe in through your tummy first, and then take it between your shoulder blades. Can you feel the difference? Does it feel that suddenly the back of your neck expands just a little bit? So as you breathe like that, I need you to think of literally the nape of your skull. So where the neck joins the skull. So I want you to breathe into the back of your spine and the top, the nape of your skull. Do you feel that you can breathe deeper into your lungs when you focus on those 2 areas? Victoria, you're kind of going so-so. Okay, because one of the things that I've noticed when working with people that have trauma and anxiety is that they find it very, very difficult to breathe into their lungs. They breathe predominantly a stomach breath, and a very shallow breath here. So it's a question of working with yourself or working with the clients and seeing, okay, well, what's the best way that I can connect with them? So this is one, and I focus on here. The other one is putting your hands on either side of your ribs. You can either do it like this, or you can cross over. I like to do it like this because I like to open my chest out. And then I want you to breathe into the sides of your lungs. How does that feel? Okay, but that worked for you, Victoria. Good.
Yeah, that feels, first, like you asked us to do, I felt like my diaphragm was quite squished actually. So although I could feel it slightly in the back of my neck, it still felt like it was squished at the front with the diaphragm. But when you asked us to do the rib one, I could do that quite easily. I could actually feel that really expanding. So that was a lot easier for me.
Brilliant.
Don't know about anybody else, if they'd like to unmute and just say.
City.
I've got a very silly question.
No question is silly.
So forgive me for asking this. When you breathe in, does your tummy expand or does it go flat?
When I breathe in, I expand everything. So I expand my tummy, then I focus on the rib cage, and then I focus on the upper part of my ribs.
Mm.
So for me personally, but I've been doing this for a very long time, I focus on kind of a 3-floor lift or a 3-breath lift. I start, my intention is in my tummy, but then within that same breath, I take it up to where the diaphragm is, and then I take it further up. And if you're able to, I take it all the way up to my skull, because there is a diaphragm at the top of your skull. So if you're able to look at the different, because there's only 2 diaphragms that medically people talk about, which is your diaphragm in your rib cage and the diaphragm in your pelvic floor. But we have, in theory, 4 that move and expand together. So pelvic floor, diaphragm of the diaphragm or the rib cage. And then we have kind of one here, which is basically where the flaps of the breath, when, you know, between the tongue. So you can actually feel that expanding out this way. And then you have one at the top of your skull, which basically allows, because your brain moves as you breathe, which is quite amazing. I mean, basically in 2018, which is not that long ago, is when they actually realized how the actual brain moved, because all the MRI scans that were done before were always static. And now they're realizing that the brain actually has a movement, just like the heart, just like the diaphragm, and just like all the other rhythms that the body has. And if you can connect with that rhythm, then you can expand all those diaphragms together. But that's practice, and that's visualization, and that's intention. City, does that answer your question, or was that quite a long, complex answer?
No, I get it. It's just because I suffer from asthma.
Mm-hmm.
And I've had asthma since I was 16. So I'm quite conscious of my breath, and I know I don't breathe enough. And when you were talking, I sometimes hold my breath, but I forget that I'm holding my breath, and then I didn't breathe. The same happens to my husband as well. He sometimes, and then I say, "Are you breathing?" I was going to breathe.
What's really important, and talking to you before we started the recording, one of the things that I felt very much from you is the anxiety that you feel all the time. Your root chakra is vibrating, but vibrating in a way that is not very comfortable. And that is possibly because you're not breathing. That's possibly because you are on hyper alert, and basically it's as if you're waiting for something to go wrong. I don't know if that makes sense, but I feel all the tension in the top of your body, and it's all here, and down here is kind of, there's a massive disconnection. So one of the things, and try the difference, play with it. You know, for example, with your breath, you say that you only breathe into here. If you're asthmatic, the reason that you're only breathing into here is because when you have an asthma attack, you're desperately gasping for air. So you kind of connect to your stomach muscles and you're kind of going, does that make sense? Because what happens is that your diaphragm goes into spasm because it's desperately gasping for air. Whereas if you can retrain your diaphragm and your brain to breathe differently, when you have an asthma attack again, you'll be able to come out of it much quicker and much, much better. Yeah. So I want you to try and put your hand on your tummy and breathe into that hand. Forget about this one, because in your case it's different. So I want you to breathe into your hand. And as you do that, feel how the breath goes up. So you're kind of filling up a ball and then taking the breath up. Does that make sense, City?
Yeah, I feel that, but I still feel
very tight.
Very tight up here.
You're going to feel very tight for two reasons. You're going to
almost
feel
like I feel I'm not doing it properly. Sorry to interrupt you.
You're going to feel tight because you will have adhesions in your thoracic because of the asthma. Okay, so one, I recommend that you go and see somebody about those adhesions, get them unlocked. And two, you need to just, it's not going to happen just today, my love. You're going to have to practice. Okay, so your homework is to breathe into your tummy and then focus on breathing into the back of your rib cage more than the front. Because when you're asthmatic, you're going to be breathing into the front because you're going to be gasping for air. Whereas if your intention is breathing into the back of the rib cage where your bra strap is and the sides of your ribs, you're going to be able to move it. But at the moment, it's just practice. Literally make it a ritual, you know, sort of when you get up in the morning, do 4, 5, maybe 10 breaths like that. When you're brushing your teeth, when you're, you know, before you go to bed, make it part of your routine as a homework. And then you'll realize that it will become part of you. Yeah.
Thank you very much. As you were speaking, I was feeling quite emotional, and I know it does bring out, once the tension releases and you figure out, oh my God, what's happening to you? You do get quite teary.
Absolutely.
I thank you for that.
So
I was just going to ask whether you work as well with sound or even singing, you know, because sometimes I feel if you are very conscious about your breathing and it makes you a bit anxious to have those deep breaths, starting also with singing loudly, if you know, if that's your, that's something you like to do. It's because you're sort of, you know, naturally you will sort of like breathing a bit deeper without associating it particularly with breath work. So that's one way, you know, just working with sound as well, just to expand, you know, like if you're a singer, you know, they say you sort of rest on that column of air, so you breathe from your belly, literally, to project the sound out. And another thing that completely different is for breath work is what's it called? I've got it in French, sorry. It's called cardiac coherence, but it's not called that in English. It's when you breathe, counting breathing, basically. And you've got this sort of wave, you know, you breathe according to, it's like heart maths, it's called as well. I'll find out more. But anyway, so that's two approaches. One could be a bit freer, and then one counting breathing. So we, you know, which is some people don't like at all.
and that's definitely something that, for example, with my long COVID patients, I get them to hum rather than singing, because some people don't particularly like to sing. They kind of go, oh, I have a bad voice, or I can't remember songs or whatever. Humming. Humming is so important because it also resets the vagus nerve. Because how it vibrates, if you think the vagus nerve connects to just literally there, when you're humming, it vibrates the vagus nerve and it basically resets it. So absolutely, the breath of humming, that can really help with focusing your mind rather than on focusing on the breath, Jolie. So yes, the other thing, the counting, for me, counting works with some people, and I always get them to count 6, 8, or, you know, sort of what it doesn't have to be 6, 8, but basically you breathe out for longer than you breathe in. And if you breathe out for longer than you breathe in, that tricks the vagus nerve again to say everything is calm, everything's okay. It's the same as, for example, if you're a smoker, the people that are addicted to cigarettes, and I used to be one of them many, many moons ago. Part of the reason why they like it is not just the nicotine, it's also the breath. Because what happens is, by you breathing in a way that you smoke, which is, it's a much longer breath out than in, it tells your subconscious that everything's okay. So if you're an ex-smoker, think about breathing as if you're smoking. And that again will calm the central nervous system down. So all of this is to calm the central nervous system down. Now, when it comes to fascia and when we're not breathing, we tend to hold loads and loads of tension in our neck. And that will impact our jaw and our neck. Then if it's still sort of contracting and being very, very tight, that's going to impact our breath. The neck muscles they can close up. Sita, one of your situations would be asthma. But also the neck holds, in the same way as your psoas holds a lot of emotions, the neck holds a lot of emotions. It holds the words that you haven't been able to speak. It holds the tears that you haven't been able to shed. It holds the rage that you haven't been able to let go of. So working with the neck is really, really important. And there's a very simple and really lovely fascial stretch that I can teach you today to stretch and work that area. Because fascial stretches are very different to normal stretches, you know, sort of normal, and I mean sports stretches. Sports stretches, they kind of, I don't know, they kind of go boom, boom, hold it for a few seconds and then let go, which I think is absolutely pointless because it's doing nothing. So let me teach you a couple of fascial stretches if you're happy for me to do that. Yeah, okay. So I need you to place your hand. I'm just going to, actually, you know what? I'm just going to remove my necklace and then it makes it easier. I need you to place your hand just above, just below the clavicle. So these bones here, and think of your breastbone. So one hand goes on top of the other. And as you're pressing down, I like to give visualizations to people so that they know how much pressure to push down. Think that you are pressing down on pizza dough and you want to leave your finger marks, your handprint on it. If you press down too much, you're not going to be able to leave your handprint. So it's just a slight pressure and you're kind of pushing in to touch your lungs or your heart. And then I want you to relax your shoulders. And you're really lovely and upright and you're staring straight ahead. And then you're going to take a deep breath in. Doesn't matter how, Sita, it doesn't matter, you just breathe in. And then I want you to start tilting your head, not backwards, but just sending your nose upwards towards the ceiling. And you're going to feel a very slight, well, in my case, it's very slight. In your case, it might be a little bit more. pull here on the front of your neck. And then I want you to sink your hands into your chest a little bit more. And then I want you to turn your ear towards your shoulder. So you're just lengthening the head away. Can you feel that stretch? Cool. And then I want you to, there's no right or wrong way of doing this, guys, okay? So some of you might have a lot more tension on one area than the other. So now I want you to literally rotate your head so that your ear is directly in line with your shoulder. And remember to breathe, because fascia will not move unless you breathe. And relax the shoulders. Relax your lower back and sit into your sitting bones. And then I want you to turn your jaw a little bit further up, away from your shoulder. Now this, for me, I feel it all the way to my ear. You might feel it to your ear. You might think, okay, I don't feel a blooming thing. If you can't feel anything, unmute yourself and let me know. And then you're going to hold that until you feel that suddenly it just lets go. It might not fully let go, but the sensation changes. And try and breathe into that space. Feel it lengthening. Feel the glute lengthening and unsticking. And then return to center and roll your shoulders a minute.
I did a lot of yawning there. Sorry to interrupt. And I know that's a sign of release, isn't it?
Yeah, good. Did you feel the fascia releasing here as well?
I could feel definitely a stretch down there. I didn't necessarily feel a release, but well, I do have a lot of neck tension. When you said that, I was like, oh yeah, mine's really bad.
Yeah.
So it might take a while.
And it, literally, the longer you hold it, you will feel as if it's lengthening away. Because I like to see it as pizza dough, because if you're going to lengthen pizza dough quickly, it breaks. Whereas if you allow it to have time, it becomes gloopy. It becomes like mozzarella, really long. And that's basically what I want you to visualize. It's kind of like really lengthening that space.
It definitely feels looser. I can actually feel, even just for doing it for what, 30 seconds or whatever we did.
Yeah. So let's do the other side, because otherwise we're going to feel really wonky. So put your hands in your breastbone. Sit on your sitting bones. Relax your shoulders. And press into your sternum or into your chest. Just a little bit. It's not a massive pressure. And then lift your head. Because I do this a lot, going up for me is very loose, but if you're finding that just going up, and if you send your jaw forwards, you can feel it really pulling in the front, then, just stay there. This is for you. So you move as you feel is beneficial. And then I want you to swap sides. So you're going to be turning your head to the other side. So the ear goes to shoulder. Relax the shoulders. Sometimes they tighten up. And relax your tummy. Scan your body as you feel that stretch. Scan your body for whatever else you are tightening, because you might be tightening your big toe for absolutely no reason. And remember to breathe. And then now I want you to focus the intention rather than on the ear to shoulder. I want you to focus your intention on the ear that's facing the ceiling. And lengthen that ear towards the ceiling just a little bit more. And breathe. Scan your shoulders. And now focus your intention on the ear that's closest to your shoulder. And now start turning it towards your shoulder. And breathe. And then release. Let go of your hands and just give your shoulders a quick going backwards. How does that feel? Good? Brilliant. I mean, these are really simple things that if you're sitting in front of the computer and you're thinking, you know, oh, I just need to connect to me, because with stress and with just, you know, sort of tension and anxiety and all that kind of thing, one of the things that is really simple to snap you out of it is just connect back to you, connect back into your body. You know, sort of suddenly feel your sitting bones on the chair, feel your feet on the floor, focus. Victoria, go for it.
So when we did the first side where I was tilting my head to the left, it was really interesting because I could feel a pull in my waistline. So I don't know whether that was like the top of the psoas or I don't know, but that I was like, oh, okay, that's very interesting.
Well, that's fascial lines. Okay, fascia has specific lines that it follows within the body, and they're very much the same lines that they follow for acupuncture. So the acupuncture lines follow the fascial lines, which energetically, if you work with energy, it's exactly the same lines. So when you have a blockage in whichever, you know, whether it's fascia, whether it's the energy channels or whether it's the acupuncture channels, then it will pull. You know, it's kind of like, as I was saying, you know, if I have a pull here, can you see how it's pulling my t-shirt that way? You know, it could be pulling my t-shirt, but it could also be pulling me below because it's a suit. And scar tissue, for example, is an adhesion that will affect your suit. So, you know, if that's something that, you know, if you're looking to do fascial work, find yourself somebody who could release the scar tissue, so that way, literally all of the fascia is moving and all of the lymphatic systems moving, which then allows the energy work to move as it should. We can't separate the systems. We've tried. We look at it separately when it comes to all the different methods of therapy, but in reality, they're all one. They're all one unit, and we need to work with the body as a whole one unit, because everything that you eat, everything that you think, everything that you feel impacts your body. You know, and when it comes to your brain, everything that it sees and thinks it's real, which I find mind-blowing. So if you think when you're watching a movie, your conscious self, your you, thinks, oh, but I know it's a movie. But your brain can't stop yawning. Good, you're releasing. You might be absolutely shattered after today. The brain does not differentiate between reality and non-reality. So if you have a very stressful life, and stress for you might be different to somebody else, okay? Just because your house is not burning down and you're not being bombed like a Syrian person does not mean that you don't suffer from stress. Okay, it is all relevant to each individual, and each individual, it is how they deal with their chemical reactions. So if your brain is constantly on fire because you're thinking, I have a to-do list the size of whatever, and you're constantly, you know, that mind monkey is constantly talking to you, then your cortisol levels are always going to be high. So if you're able to quieten, you know, sort of silence that mind monkey, control that mind monkey, and give it space, like we just did, you know, when you were doing it, it's not just the doing it, it's the scanning your body, it's the breathing into your body. You know, me saying to you, okay, scan the rest of your body, what else is tight? That suddenly brings you, hones you into you and gets you out of this, which is what we need to do to be able to find peace. Does that make sense? Any comments, any chats, any questions for now? Okay, so I want to talk to you now about the psoas and the energetic system. I'm not sure if you're into that, but because I work on so many different levels, I think it's quite important to comprehend the different levels. So the psoas is the center of your soul, okay? And it sits within the cavity of the abdominal wall. So all of your organs, everything is sitting in a bag, which is quite fascinating because you kind of think that your organs sit in your body, but they don't. They sit inside a bag. And then within that bag, you have things that come in and out. For example, your esophagus and things like that, they break through the bag. And then the psoas, because it has the central nervous system, which is the vagus nerve, that's where you get that feeling of your gut feeling. You know, when you follow your instinct, you're feeling it in your tummy. And that is where the psoas sits. And when you don't listen to that, then that causes a plethora of chemical reactions that are not necessarily very beneficial. And if you replay life events, hence why PTSD is such a bad process for your body, is because every time that you relive life events, the psoas reactivates and the central nervous system reactivates, causing a kind of flow of chemical reactions in your body every single time. So Victoria, when you say that you're yawning a lot, and when you do fascial work, more than just a massage, when you're doing fascial work, when you're doing energy work, the person can have a massive emotional outlay. And they sometimes don't know why. They kind of, you know, sort of they're bawling their eyes out on the table, and then 2 seconds later, they're absolutely fine. And they go, I feel amazing, but I don't know what that was. And that's basically because the chemical reactions that you had released at the time of the event are still lodged in your body. And if you move those chemical reactions, you're going to feel those emotions again, even if that feeling was 20 years ago. And then if you're able to move them, then they pass through you, and then they enter your lymphatic system, and then they unblock the energy system, and then bosh, gone. You've shedded it. It's over. Whereas if you have a memory, if you have a trauma that you can't unhook, those chemicals will keep being produced. And unless you can find a space to release, then you're going to basically get sick or have pain. Now, when it comes to energetically, when I work energetically, I have found that with, I don't know if you know much about the chakras and whether that's a field that you're interested in, but the chakras also have their spheres of energy. And if you look at an anatomy book and you look at the 7 chakras, where they sit is in the main central nervous systems. So when you look at, you know, sort of the big bulky areas of the central nervous system, because you have nerves everywhere, yeah, but the big ones sit in the 7 chakras, and the big ones sit in all the lymphatic bundles, which is kind of mind-blowing. You kind of go, oh my God, that makes so much sense. Now, with the chakra system, you know, if this is an area that you know how to work, you will feel the chakra and whether it's rotating in the right way or whether it isn't. And you will feel whether it is deficient or overfilled. And it's really important to be able to balance all of them if you're able to. Everyone has the 7 chakras. Some of them are deficient and some of them are overfilled, in the sense, for example, when you have somebody who, I'm just thinking, a quick example, when you have somebody who is very into being promiscuous, very much into sex, that's usually the root or 2nd chakra that is deficient, that is overfilled. So that's an extreme example, but I wanted to give you that extreme example so you could understand, you know, sort of when you have one that's deficient and when you have one that isn't. One that is deficient would be somebody, let's say the 2nd chakra is deficient. It could be that they are very introverted or very, very insecure or very unable to believe in themselves. That's a deficiency. So you're not going to be able to change what they feel or how they feel. But if you rebalance the system and you rebalance it as well with calming the parasympathetic, I know I keep banging on about the sympathetic nervous system, but if you are able to calm it down, if you think of the fact that they all sit within each chakra, then they will all be balanced together. Does that make sense? Brilliant. Now I'm going to give you one more for your neck, which I think you'll enjoy, especially Victoria, if you're saying that your neck is very tight. So I want you to have your fingers like so. It's a soft, really soft fist. And I want you to lock it. So there's my clavicle. I want you to lock it here. So if I show you, that's my SEM. I've got 2 of them. One's here and one's here. So I'm going to lock my fingers, my little knuckles of my fingers on here, and then I'm going to place the full hand width along the SEM. Okay. Now, ideally, if I hold my elbow or I do it on a table, it doesn't really matter which. And this is not, with fascia, you need to ask permission. You don't just shove your elbow or your fist and just pull, because that's really horrible, okay? So again, think of you're putting pressure on pizza dough, and suddenly you'll feel that it's allowing, it's giving a little bit. Can you see how suddenly it's kind of melting my knuckles into it? And I'm just going to try and straighten my wrist. I'm not going to do anything. I'm just literally, my wrist is bent. I'm going to try and straighten my wrist. And as I try and straighten my wrist, and then I'm going to glide my hand up. Can you feel that? And then I turn my head. And as I turn my head, my fist very, very gently goes around the back of my head. And again, I'm scanning. I'm releasing my shoulders. I'm going all the way as far as I can, and then let go. And then I'm going to do that one more time. I'm going to turn my hand a little bit further that way. And again, I'm just going to glide. Glide. There's no pressure. The gliding is happening all by itself. And once I get to my jaw, I start turning my head to look at my armpit. And if you find what is called a trigger point, so an area that is painful, just stay there, breathe into it until that area changes. The change might mean it goes up or down. It doesn't really matter. It just needs to be a change. And then all the way up to the base of my head. And then release. And you'll see that it goes red, but the redness, what the redness is the fascia that's moved. So we're going to do the other side. So little fist onto, sitting on the clavicle, locking into my neck, holding onto my elbow so that there's no tension. And just very slowly and gradually sending that hand up, allowing it just to do it by itself. Breathe. And then turn the head and go to the base of your neck and skull. And then all the way to the back of your head. And then release. And then one more time, we're going to glide up. So if I breathe really deeply, you'll see my SEM very clearly. That's the muscle we're working on. So you can come in the front of it and then just glide it sideways. And then once I hit my jaw, I come round. All the way. Beautiful. And then lastly, I'm going to show you the back of me. I want your thumbs to be like that. And you're going to place them here. So if I just, in there. And I want you to be right in the center. When you feel right in the center, you're going to feel a little hole. Yeah, can you feel that little hole? And then I want you to just lock your thumbs in there. Your hands are like so. And I want you to drop your shoulders and then drop your head into your thumbs. In some of you, you're going to find this very painful. If you have lots of trigger points in there, lessen the pressure or lessen the amount that you're dropping your head. And breathe into it and feel how it changes. Relax your shoulders. Feel your neck lengthening away from your shoulders. And then very gently move your thumbs away from each other and place them right deep where those big muscles are. And then again, glide your fingers away. So you're moving like centimeter by centimeter. And again, you're going to find 2 little holes or 2 little dips now. And I want you to bring your chin to your chest as you're keeping those fingers there. And then bring them back up and allow your fingers, you're trying to envision that you're trying to put them underneath your cranium and underneath your skull. And then walk your thumbs out towards your ears and keep bringing them out just a little bit by little bit. And then once you have your hands on either ear, I want you to just give yourself a circular rub. Dropping those shoulders. And then around the ears, just at the top. And then around here, all the way around. And then let go. How did that feel?
I struggled with that one a little bit because I cut my thumb yesterday with a knife, so I was like, I can't do it. But yeah, it's interesting actually, because I don't know whether you can see this, but I think it's called a guaya or something like that. I was recommended this by a friend, and it's a crystal one, and you do what you're suggesting really, but you know, down the neck, and I'm in, yeah, so I was like, oh, actually that looks similar to what she's asking us to do, but I found that one harder, but I think that was just because of the plaster and the thumb. So, but over to anyone else who'd like to pitch in.
Jolie, you're saying that you have a painful shoulder. Talk to me about your shoulder for a second.
Yeah, no, I've got arthritis apparently. In fact, they were suggesting I had some some injections, but I'm hesitant.
Have you been scanned?
Yes.
You have. So you definitely have arthritis. Okay. I would recommend that you go and see a fascial specialist before you get a jab.
Oh no, I don't want to have infiltrations. I don't think steroids are the way.
The fascia sometimes with arthritis it's very, very stuck. So we've got a few minutes. If you're happy and everyone else wants to try out the shoulder, let's help Jolie out for a second, if that's okay. So I want you to place your thumb around the front of your shoulder, like so. You're going to drop your arm. So put your arm on a comfortable table so there's no tension or there's no hanging. Yeah? Is that comfortable, Jolie? Okay, so I want you to think the deltoid, okay, is a muscle that goes like so and attaches to here. You can kind of see mine. It's there. So that's the one, that's where I want you to work, okay? So you're going to hold on to either side of your shoulder, like so. And you're just going to hold on without pressure, okay? There's no pressure. Imagine that, again, you are slowly sinking your fingers into pizza dough. You're not grabbing anything, yeah? And think of the 4 fingers behind your shoulder. And really feel, I'm going to rotate so you can see, really feel those fingers kind of sinking in. I'm not digging them, I'm just allowing them to sink in. Okay, take a deep breath and feel as if you are grabbing that entire deltoid. And you're going to give it a nice little squeeze, a really gentle squeeze. And as you do that, you're going to try and rotate. So in my case, my body wants to go that way. In your case, it might want to go that way. So see which way it wants to go. You always work towards where the body wants to go, not against it. And then I want you to squeeze and keep pulling.
How would you know which way the body wants to go? What signs would people feel, for instance?
It will feel easier. So you work towards the ease rather than towards the against. So my body, my muscle, feels easier to go this way than to go that way. So if your muscle feels more comfortable going that way, then go that way. Does that make sense? Okay. So I want you to keep pulling, and then bring it down. So I'm going to stand up so you can see. And then release. And you're going to do that again. So you're going to grab and then push in. So it's as if you're kneading dough in a really nice fashion, okay? So then you're going to push in with your palm very gently into that bone area. And then I want you to really softly grab hold of it again. And I'm going to stand up. Imagine my hand is on a table. I'm going to drop it off the table and I'm going to just allow that to sink and bring it back. So I'm holding on. I'm not doing anything to my hand. I'm just holding on. And I'm going to drop, lift, and bring it back. Hold on again. Dropped, lift, and bring it back. How does that feel, Jolie?
Yeah, there's everything's quite uncomfortable. The movements are quite uncomfortable. It always radiates. It's painful. That originally I had some chest X-ray because I didn't think it was a heart, but anyway, they thought it might be heart related. But I kept on saying, no, it clicks, it's really painful from here, from underneath, the whole around the shoulder area rather than chest, Anyway, so I had both in the end. So because they were going to send me just for the chest X-ray. Anyway, so and it's really, it's very uncomfortable.
One of the things that I have found through life is that when things are really uncomfortable, people don't want to touch it.
Yes.
You need to touch it.
Yeah. It's even the grabbing, it's just, it seems to wake it up.
So then rather than, grabbing it, just place your hand and hold it in. It's more your own energy and your own warmth can help that joint. The other thing that I would recommend is that you look at your lymphatic system, because your lymphatic system is not clearing. What is that?
The whole body problem, I realize.
So
all this weight gain over a few years back, which I just cannot really realize. No. Yeah.
Okay. So I will send you, well, actually I can put it in here. I have a little video that I send to clients that they can do to help their lymphatic system. It's a really simple video. And if you follow it every morning, it will help the pain that you have here. Because this pain here is not just the arthritis. It's because things aren't clearing. And because things aren't clearing, it's blocking all of this. So we need to clear it, and you can do that manually, very gently, by yourself. Okay, so I will send the link to Victoria and see whether she can place it in and try it out. I mean, I've had clients that do it and they ask me, I'm now sweating, is that normal? It's like, yes, sweating is good. Sweating is what your body needs to clear. Can't hear you, Victoria.
If you happen to have the link that you could put in the chat, what we can do is then save the chat and we can do it that way. So if you're able to do it whilst we're still online, that's probably easiest. Because I don't know how Claire will pop it on the website and that kind of thing. either that, or if you're happy to, when we share that obviously we've had this meeting today, we can always do, we can just add it in comments, as long as you're happy for everyone to see that, then we can do it that way.
Yeah, I'm just going to have a look to see whether I am clever enough to do this, but
sure you will be. But it's interesting, whilst you're having a look for that, it's interesting actually, because I don't know who in here has heard of Donna Eden, but she does a lot of obviously the energy medicine. And I will say in you know, in backup to what you're saying, actually, I did her daily energy routine probably way back last year, actually, sort of January, February, I started doing it. And it's literally 7 minutes a day, and you do work with the lymph system of obviously massaging the points and stuff. And the energy that I had was incredible. I felt super buzzed, like I'd had, you know, double caffeine shots. You know, I felt much more motivated, and that was purely from just doing her 7 minutes of the energy medicine and the massaging the limbs, like, you know, what you're talking about. So you know, that's it's just shows, doesn't it, really, that
well, it's just they work hand in hand, you know, sort of, again, you know, in the same way as the energy system, the fascial system, the acupressure system, and the lymphatic system, they all sit together. That's why you can't separate them. I'm still looking.
No, that's okay, don't worry. I mean, if so, as well as the video, if anybody does want to have a look at the Donna Eden, she has it on YouTube. It's literally like 7 minutes, just called the daily energy routine. And there's various people on there, but I do prefer her one. But that's really interesting to do. As I say, I did that, and that's all to do with, again, you know, she talks about the acupuncture points, the triple warmer, and, you know, that kind of thing. And I did really know, and interestingly, like, it's amazing how much you do take on board. So I do notice now, where she was doing the massaging for the small intestine, I do notice now when I kind of go, oh, that's a bit sore, and I'm like, oh, okay, what have I eaten? Small intestine. And yeah, okay, I did have bread earlier, and, you know, and things like that. And I can sort of see how it's linking, but it's, you know, hopefully I'm speaking for everyone else, but I do feel this has been a really exceptional talk today. I mean, I hadn't even thought about the smoking link to do with the breathing, but so totally true. I mean, I had one question for you just before and somebody else might have other questions. Is, do pets have a psoas muscle? Because I know obviously they have fascia. I know Edward Basingthwaite works a lot with the fascia side of things, but
Hi everybody. So today we are talking lymph nodes.
You need to close that.
yeah, it's all right. I've just popped that.
That's the video.
At least we know it works. We know it works. So thank you.
Yes, they do definitely have a psoas muscle. With pets, I mean, I don't know how you work with your pets. I've worked with horses before, and but I work fascially and energetically with a focus on the chakras, and it's quite amazing if you can link both. If you can look at the psoas and work, you know, sort of that way, but start, if you know, if you're doing energy work, I'm assuming you work with a chakra.
I do energy work. Sorry, I'm just going to grab my charger. I do energy work, but I don't do the fascia release. So I would do it in an energetic healing kind of way. Okay. So you'll be focusing on one layer. So when you're focusing on one layer, start off with the third eye and heart. Okay. And then move. Does that make sense? Yeah. So yeah, start off at the front and then move down to the psoas, because the psoas is the first and second chakra. Yeah. Okay. That's predominantly where that psoas sits. So solar plexus type area. Okay. Thank you very much. No worries. So does anybody have, like, we could probably take one more question in the time, if that's okay. So if anyone has a question.
Okay.
Thank you. I wanted to say a big thank you to Margarita for your help for me and for these wonderful exercises, and for and to Victoria for putting Margarita on here. I have I'm gonna try and do what you say if I remember. So I'm looking forward to the replay. So so I can play it back again. My husband has fibromyalgia.
Okay.
So I know that my fascia helps a lot with fibromyalgia, and especially the way that you're explaining it, it makes a lot of sense.
Mm. Mm. With fibromyalgia, there's a lot going on energetically. There's basically, how can I put it? When you have somebody with a condition like fibromyalgia, is that they don't want to be in their body anymore. Their energy system wants to be out rather than in the vessel. And it feels very restrictive. It feels very uncomfortable for them to be in their vessel. So if you can find an energy worker, that would be very helpful for them to work and be enabled into basically sitting within the right energy systems. What happens is if you look at it like a highway of energy or cars, what's happened to him is his highway has been over flooded and they've all come out of the lines. So he needs somebody to put the lines back to where they should be. I don't know if that makes any sense, but that would help. The lymphatic system will help, and the fascial work would help. One of the tips that I do give my clients, and this is the last thing before we go, is get yourself some sticky post-its, the little tiny sticky post-its, and put them throughout your house. Put them by the kettle, put them in the shower, put them by your toothbrush, put them in lots of different places. And when you look at the sticky post-it, it will remind you to breathe. Put it in your car by the radio. Every time we're at a traffic lights, we look at the radio. Look at the radio, think, oh, I need to breathe. So integrate it into your day-to-day, and that will help. Right. It's been an absolute pleasure, everybody. Thank you very much. I could talk like this forever. This is my passion. This is what I do. I love the human body. I love the energy systems. So if you have any questions, please, do reach out. I am more than happy to help and advise and guide.
Just one other thing. Where are you?
I'm in Hove.
Oh, I'm in Eastbourne.
Ah, there you go. Come and see me.
So would you like to share your contact details, Margarita, just so anybody, if they do want to get in touch with you, please? You can either say that verbally or you can share it in the chat, whichever.
I can share it in the chat.
Just whilst you're doing that, I can definitely affirm to what Margarita's saying regarding the fibro, because I am doing is what I say, fibro, but I've got rid of a lot of it by doing energy work and emotional trauma work, not just from actually this lifetime. So actually past life stuff that's been stored in the cells. I've worked a lot with that, and there's very little left now, which really confuses doctors, but that's quite fun. So I can completely understand that, and certainly from my experience, and I suppose it goes in line with what you work with anyway, Margarita, is a lot of it does seem to be very much down to trauma. So it's been an interesting journey for me. So I hope your husband CC can definitely sort of either get in touch with Margarita and go and see her, or definitely someone near. So yeah, thank you so much, Margarita. As I say, I think it's been really beneficial today, and I hope that more people in the network will look at this replay, because I think this could be really useful. I've certainly understood a lot more about the human body and just linking things together and learning the fascia exercises. As I say, I was yawning for quite a while, and interesting, my left eye kept tearing. I wasn't crying, but it just kept weeping, and I'm like, okay, fair enough, whatever, it's a release. So that has been very interesting as well. I will just very briefly before we go, so yes, Margarita's put her details in there, so I'm going to save the chat, but I'm just going to pop my details in there because someone else has asked for mine as well. So I would like to thank everyone for attending. I know some of you have been here today previously with us, Magdalene. I think it's the first time I've met with yourself, so it's been lovely to have you here as well. If anybody does want to speak for the network, then obviously please get in touch. There is a section on the website www.therapist-network.com, where you can actually say that you'd like to be a speaker for that network. And we are looking for more, well, I mean, you can share your therapies and what you do, but also we are looking for things that can help therapists. So just as Margarita has done very kindly for us today, so that's been very, very useful. Thank you. So is there one last thing at all you want to say, just whilst I'm popping my details in here at all?
Not really. Thank you very much for the opportunity. It's been an absolute pleasure. Jolie, I saw you.
Just quick question. Do you participate in retreats or do you work with other people?
I'm happy to do either, but I've never done either, if that makes sense. I am a lone wolf working from my clinic at home, but I am very happy to be part of a pack.
Well, thank you so much. Thank you for sharing all of your knowledge and wisdom this morning. It's been really good and we've loved having you here. Obviously, if anybody would like to get in touch with Margarita, then please do. As I say, her details are there, so I'm just going to leave them up for a couple more moments just so that people can jot that down. I will save the chat as well, and hopefully then that will do what it needs to do. So yeah, thank you very much everyone for attending for Margarita's talk this morning. Enjoy the rest of your weekend that is coming up, and we shall see you at the next talk. I believe there might be a talk next Tuesday evening for recollection, but just keep an eye on the Facebook group. If anybody's not in there already, then obviously please do join that. And yeah, we'll see you all very soon.
Wonderful. Thank you.
Thank you. Take care.
Take care, everybody. Thank you so
Bye,
much.
Sweetie. Thank you.
Bye. Bye.